Mr. Stevens. I wanted to talk with you a little bit about your heart care.
Okay.
How are you feeling today?
I'm a little sore, but pretty good.
Okay. Maybe you have some questions about what is congestive heart failure?
Well, I guess I don't really understand kind of the whole picture of what's happening.
A healthy heart, as seen here, beats approximately 60 to 100 times a minute, providing oxygen-rich blood to the rest of the body. The lower left chamber of the heart, called the left ventricle, is the main pumping chamber. There are many different conditions that can lead to congestive heart failure, including a prior heart attack, high blood pressure, and coronary artery disease. Any of these can prevent the heart from efficiently pumping blood to the rest of the body. As a result, the heart may beat faster and the ventricle may reduce blood flow. They attempt to compensate by retaining more water and salt. This excess fluid retention often causes congestion in the tissues and results in swelling and an increased strain on an already weak heart. The increase in size, becoming an even less effective pump.
A quick overview of the heart. I've written down some terms that you'll need to understand. As people are talking to you, they may use some of these terms. You have been diagnosed with heart failure. That doesn't mean that your heart is stopping. It just means that sometimes you don't have enough blood to keep up with the needs of your body.
Okay.
There's also a term called ejection fraction, and that's what we'll be measuring tomorrow when we do the echocardiogram, and both of those terms are explained here for you. Now, the next piece of this is how should I be eating? I mean, how do I feed my heart in order to stay healthy? And I brought along a couple props that I want to show you. Sometimes as we're talking about eating, it's difficult to understand how much. So if you were to guess, how much would you say if I were to fill that with water? How much water do you think that would be in ounces? Do you think 10 ounces or 2 ounces, or what would you guess that to be?
I'm guessing 8.
8 ounces. You are absolutely right. This is 8 ounces. And one of the things your doctor will talk to you about, and you'll want to remember, is about 8 glasses of water a day, or 8 glasses of fluid a day would be all that you would want to have. And that would include coffee, water, tea, and any other foods that have a lot of fluid in them. Like if you eat Jell-O, or if you have fruit and it has fruit juice with it, or what other kinds of fluids do you have?
I'm not sure, but you're saying that that's the top number? Don't go over that.
Don't go over that.
Oh, okay.
Exactly. So that's as much fluid as you would want to have in a day's time for now.
8 ounces, 64 ounces. Okay.
64 ounces.
Okay.
This is salt, and salt is a good thing, and lots of people, they put a little salt in the water before they start cooking, or they sprinkle salt on their plate. And salt contains sodium, and your doctor is also wanting to limit how much sodium you have in a day, and he'll give you a number, like maybe he'll say 2,000 milligrams, or maybe he'll say 1,500 milligrams. So when you get home, you may want to just kind of set that salt shaker aside. What we have here. So if we said this is protein,
Okay.
and this is whole grains, and what does the term whole grains mean to you?
Oh, like wheat bread or something like that?
Okay. Or oats.
Okay.
And then this other half down below is going to be fresh vegetables. Fresh vegetables, either raw or cooked. So that's a significant portion. I've also written some of this material down for you in your handout. And there's a couple of websites that I'll show you in just a few minutes on our interactive video called What's on My Plate, that just goes over some of those, the portion sizes. And Mr. Stevens, your doctor has prescribed 2 medications for you. And the important important to remember is to take those as prescribed.
Okay.
Don't try and make up a dose if you forget it. Also, it's important that you're not taking other over-the-counter medications with that. So ask your physician, can I take Tylenol? Can I take vitamin supplements? What kinds of things can I take if I get a cold? Don't take other medication at home with your medication, and make sure you always take your medication as prescribed.
Okay.
If you are about to 1 week of needing your medication refilled, that's the time to call your physician's office and ask them to refill the medication.
Okay.
Before you leave the hospital, we'll put your physician and pharmacy's numbers into your cell phone on speed dial, so that if you have any questions about your medication, you can go ahead and just dial that up.
Okay, good idea.
You'll also have the visiting nurse's number in your cell phone, so that if there are other medication questions that need to be answered, they can answer those as well.
Okay.
Okay?
Okay.
Within your handout, I have written down, you're going to be on Lanoxin and a water pill called Lasix, and I have written information about both of those so that you can read over that as we go along.
Okay. All right. Good.
Okay, Mr. Stevens, as you're going home, another part of being at home is that you'll be weighing daily. Now, do you have someplace at home that you'll be able to set a scale that's a hard surface?
Yeah, like ceramic tile.
Ceramic tile, like in the bathroom maybe?
Sure.
Okay, and do you have a scale that you
Yeah.
can use?
Not like this, but one of the floor model kind of
Sure,
things.
that'll be great. Now, some people, this works fairly well for them. They get up each morning, they go to the bathroom, and then they go in and weigh themselves before they go eat breakfast. Would that be something you think you could do okay? Or
that'll work.
Okay, and then each day you'll want to weigh yourself and record it on this sheet of paper. You'll need to take this with you each time you go to the doctor.
Oh, okay.
Okay, and what he'll be looking for is that your weight stays pretty much the same. That's how we know if your heart continues to work the way it's supposed to. If there's a weight gain of 3 pounds overnight or 5 pounds in a week, you'll want to call the physician or the physician office right away. Okay?
3 or 5.
3 or 5.
Okay.
Perfect. Okay. Exercising is an important part of staying well.
Okay.
Just as you recall from our teaching, there's some exercise rules. Not to exercise after you eat for about 1 to 1.5 hours.
Okay.
Important to exercise every day. What's something that you could do every day?
Well, I like to bike ride. I like to swim.
Okay. And are there places that you can go to swim? I mean, do you?
Yeah, I go to the Y, so it's indoor.
Okay. And is there someone who can drive you if you're not able to drive? Okay, or you can take a bus. Or all right. Okay. And another thing to remember, if you're biking, that outdoors, not below 32 degrees or above 85 degrees.
Okay.
Okay. You'll start with about 5 to 10 minutes every day, and then you add like a couple minutes only every other day, so that after a week you're up to about 15 minutes of exercise.
Okay.
Okay? Now, how would you know to stop exercising?
Out of breath?
Right, exactly. If you get short of breath or your chest starts to hurt or it feels heavy,
Okay.
you would stop right away.
Okay.
And then you would let someone know as well. So if you're at the Y, you would want to let someone know, oh, I'm having some chest discomfort. Could you call my physician? Okay? Mr. Stevens, it has been a pleasure. We wish you well. And we have the wheelchair, and I've called transport, so we'll just send you right on out.
Well, thank you for your help.
Yes. we'll look forward to hearing from you out, but not back here in the hospital.
I hope that's true.